Good afternoon, everyone, and thank you for joining us today at Mayo Clinic Health System in Northwest Wisconsin. My name is Kristen Everett. Speaking with you today will be Dr. Richard Helmers, Regional Vice President of Mayo Clinic Health System in Northwest Wisconsin, Jason Craig, Regional Chair of Administration for Mayo Clinic Health System in Northwest Wisconsin, and Pam White, Chief Nursing Officer for Mayo Clinic Health System in Northwest Wisconsin. We want to let you know that before we begin, in accordance with Mayo Clinic Health System safety guidelines, it's important to note everyone you see on your screen right now is alone in their own office, allowing all of us to safely speak to you while not wearing a mask. Following comments from our leaders, they will be answering questions submitted prior to this event, and we hope to get to as many of those as time allows. So let's begin by hearing from Dr. Helmers on the current COVID-19 situation here in Northwest Wisconsin.
Good afternoon, everyone. I'm Dr. Rick Helmers. I'm a pulmonary doctor, and I am the Regional Vice President for Mayo Clinic Health System here in Northwest Wisconsin. Thank you for joining us today. You are key partners in our Western Wisconsin region. Leaders from schools, law enforcement, local government, nonprofit and service organizations, clergy, and business. You all have a stake in the impacts of the pandemic on our communities. Protecting our patients' health and safety is our highest priority in the Mayo Clinic Health System. Our commitment is to our patients, our staff, and our communities, and to be transparent and honest about the current COVID-19 situation in our communities. There's no other way to say it. We absolutely need your help. We're facing a sobering reality here in Eau Claire and surrounding communities. Our COVID-19 community infection rates continue to increase rapidly. The number of people who have tested positive throughout Northwest and West Wisconsin is staggering. And we're seeing a surge of COVID positive patients in our hospitals, and the situation is indeed serious. We're sharing this transparently because we need everyone's help to slow down the spread.
Thank you, Dr. Helmers. And next we'll hear from Jason Craig, our Regional Chair of Administration.
Good afternoon. I join Dr. Helmers and Pam in welcoming all of you and thanking all of you for taking the time out of your busy calendars to join us here today. We also want to thank you ahead of time for your willingness to hear this information and hopefully share this information and influence the behaviors of others within our community. We're, of course, asking you to do that for the benefit of all in the community, but in particular for the benefit of our staff who are struggling with COVID-19 currently, both in their day-to-day care activities and capacities, but also as this illness continues to affect them personally. The combination of COVID-19 admissions and the prevalence of positivity in our communities is causing a considerable strain on our ability and threatens our ability to continue to meet the care needs of our community. I have some data to share with you today that really crystallizes the challenge facing our community and is updated information from the numbers that we shared just about a week ago in our media event. If you recall, about a week ago, we shared with all of you that we had just about 200 staff absent due to COVID-19 related restrictions, either exposures or positivity. Unfortunately, today I'm sharing with you that we are nearing the 300 count for staff being out of work due to positivity or exposure to COVID-19. For many of you joining us here today, the number of staff we have out well exceeds the total number of all of your employees within your businesses. 300 is a very, very significant number for us, and again, approximates just about 6 to 8% of our total staff. Additionally, we shared with you last week that our weekly testing positivity rates were between 22 to 25%. Unfortunately, this week, we're seeing that trend continue upwards, and we are now in excess of 26% daily positivity rates. We've had multiple days this week when in excess of 300 individuals have tested positive for COVID, and now our daily average is in excess of 200 individuals testing positive for COVID every day. We currently have approximately 70 individuals hospitalized in facilities throughout Northwest Wisconsin. And now, unfortunately, half of the inpatients hospitalized for COVID-19 in our ICU require ventilator support. Remember that whether on our unit or in our ICU, a very large number of these COVID-19 patients require one-to-one care and are highly acute, requiring more of our staff time. So when you combine the absence rate of our staff and the increased acuity and critical nature of the patients within our facilities, you can see how our ability to continue to deliver care is threatened. Fortunately, due to the deferral of elective work within our region, we have been able to redeploy staff and maintain accessibility to our urgent and emergent services. So that's a point of emphasis here today. We remain available for your urgent and emergent care. We continue to deliver those services every day and every hour of the day throughout our region. But we share this data with you in an effort to better educate you as to the threat facing our ability to continue to deliver care. And again, in the hopes that you'll take this information and influence others within the community to help our staff.
Thank you, Jason. Up next, we're going to hear from Chief Nursing Officer Pam White.
Good afternoon. I'm Pam White, as Kristen has mentioned, and I'm the Chief Nursing Officer for our region. I can only echo what Dr. Helmers and Jason has already mentioned. As you can imagine, this surge in COVID-19 cases in our region takes a huge physical and emotional toll on all of our staff. We really are human, and we're really tired of this just like you are. If you don't serve in healthcare or have loved ones who do, it might be hard to believe things are so dire, but we're here to assure that we are at a critical point in the Chippewa Valley. We're asking for your help in supporting our staff so that we can keep our capacity and ability to care for everyone in our community. We currently have a no visitor policy, as I'm sure you're aware, that's in effect, and we know how extremely hard that is for our patients and their loved ones, as it's very hard on our staff as well. I know that you understand that these decisions are not made lightly, and they're done out of an abundance of caution to continue keeping our staff and patients as safe as possible. We are all tired. Our staff are working many extra hours and shifts in order to provide care for those in our community who need it most. We're here to serve. That's what we're all about, but we're also reaching our limitations. We only have so much staff. We're exploring all options right now. We've contacted retired staff. We're looking at students and how they can help. We're moving our staff from our ambulatory areas, and we've called in nurses from Rochester and Arizona to help us. We've also brought in travelers. This is not something we do on a regular basis. Our managers, including myself, are putting on our scrubs and doing what we can do to help our staff and, most importantly, our patients. I know as you drive by our organization, it doesn't look different on the outside, but I can guarantee you that the experience that we're feeling inside is much different. All you have to do is walk down the halls of our critical care unit, and you will see what the real situation is like in the Chippewa Valley. We recognize and share your fatigue with all that this pandemic has done to our personal and professional lives, but staying safe and leading by example remains critically important. Thank you.
And thank you, Pam. And again, thank you, Dr. Helmers and Jason. We know many people submitted questions for you to answer. We want to work through as many of those as possible during our time so the community can hear directly from you the current state of our situation, the forecast for the future, and also what they can do to help. So I'm going to begin by sending the first question to you, Dr. Helmers. When will a vaccine be available, and when would Mayo Clinic plan to have them available?
Thank you, Kristen. We anticipate having a vaccine in the first quarter of the new year, and we're developing plans to quickly stand up vaccination clinics when we receive confirmation of our allocation from the state of Wisconsin. There are a number of clinical trials underway that are showing promising results And this is due to the tremendous effort of scientists all through the country, including Mayo Clinic scientists, to develop and test these vaccine options. And it's important for everyone to understand that even if emergency authorization is given by the federal government, vaccine developers will be expected and will have completed very rigorous safety requirements. So when the vaccine is available, it will be safe.
Thank you, Dr. Helmers. This next question, Jason, I'm going to send it your way. I see that many high school and colleges have approved winter sports. What is Mayo's stance on this?
Sure. Very good question. Obviously, very timely as we move into the winter sports season. The key, of course, in all of the steps that we're talking about are proper mitigation efforts. To be perfectly candid, if we cannot ensure proper mitigation steps within the various sports, we would not recommend that those sports continue. Now, there's a lot of layers and a lot of nuance that goes into that, and I think our school districts have put in a tremendous amount of work and effort to maintain those mitigation efforts and to put them in place. And we particularly want to recognize those school districts for those efforts. Having said that, there's a lot of winter sports that are very unique from fall sports in that they cannot be conducted outdoors. That creates a different level of risk. And the winter sports also carry with them, in some instances, a higher likelihood of person-to-person contact in close proximity. So again, for those sports where proper mitigation efforts can be put in place, obviously we think that there is a tremendous benefit. For those that cannot, we would not recommend that they continue.
Thank you. And Jason, I'm going to send one more your way. If Governor Evers mandates a safer at home order similar to back in March, how will my business and healthcare be affected?
Yeah, a very, very good question. So first off, I think the likelihood of an order similar to what we had in the spring is very, very low. Simply due to the many developments that have occurred since then. It actually, to me, emphasizes the importance of today's session and the various communication efforts that we're making and attempting to leverage all of our contacts and all of those who may be interested in helping us. It's important that we all take individual ownership and spread our influence to follow the public health guidelines. Masking, physical distancing, hand washing, and getting the flu shot. We have to adhere to those. And to be perfectly candid, we have to begin influencing others in all of the different capacities that we have. Again, when the safer at home order was in place, we saw a much lower prevalence. The likelihood of that happening again is very, very low. So we must count on ourselves and count on each other to be able to get some control over this virus spread.
Thank you, Jason. Pam, the next question will be for you. Can someone clarify what deferred practice means? Am I able to attend my scheduled clinic appointments for routine care?
Sure. I think Jason spoke to a little bit about this earlier, but it's good to repeat this. Even though we're deferring elective surgeries and procedures, we are open. It does not, and I repeat, it does not mean we are deferring all care. Emergency, urgent care, OB care will continue. And we also plan to maintain other important care for folks with underlying health conditions, including cancer. So it's truly elective surgeries that are not urgent. We are open. Registration staff will call patients if an appointment needs to be rescheduled or if there's an opportunity that we could shift the visit to a virtual visit. So we also are asking our patients to speak up. If they believe their care needs are urgent and can't wait, please have people contact their doctor. We are open and we want to provide the care to our community.
Thank you, Pam. Another question for you. Why aren't we hearing the same concerns from other healthcare organizations in our community? Are they in a surge capacity as well right now?
I can tell everyone that we're in close contact with other healthcare providers across Northwest Wisconsin region, and many are seeing similar concerns as we are with this surge. It's not an issue that will just be experienced by our organization. It is across the state of Wisconsin and across the Chippewa Valley.
Thank you. Dr. Helmers, COVID-19 is no worse than the seasonal flu. Why should I be concerned? Is misdiagnosis possible?
Thank you. So COVID-19 is not just like the flu. While some people can have no or mild symptoms, others can be quickly and severely impacted by this. During non-COVID times, we would be significantly concerned if we had 5 or 6 patients in our hospital with influenza. Today, we have nearly 70 patients in our hospitals with COVID-19.
Thank you. Jason, some seem to suggest doctors and hospitals are falsely reporting COVID-19 cases to make more money or make the pandemic appear more severe. Is this true?
Great question, obviously a timely question. So let's get a couple of things straight. So according to the Wisconsin statistics, approximately 5% of those testing positive for COVID-19 require hospitalization. Certainly not all patients with that diagnosis require hospitalization. 95% do not require hospitalization. It's also important to understand whether or not the patient is COVID-19 positive or not, if hospitals are delivering unnecessary care, Medicare and payers will not pay for that care. So the narrative that there's a profit motive behind COVID-19 is flatly untrue. And if you really think about it, to think that we would defer elective work, which is much, much higher volume, in order to care for a COVID-19 population that's much more critical, much more resource intense, just from a base financial perspective, that just does not make sense logically. We're in the midst of having to redeploy our staff from those units to care for these critically ill patients who have COVID-19. And again, from a financial perspective, the narrative from our organization perspective just doesn't make sense.
Thank you, Jason. Pam, is it true that spikes in COVID-19 cases are because of increased testing?
No, I can tell you that the rise in infections is not related to increased testing. What really causes more concern than the number of tests performed is the increase in the percentage of positive results. And we're seeing that positive result percentage continue to go up. This just means that the virus is spreading quickly in our communities, and that's what we're experiencing today.
Thank you. Next question for you, Dr. Helmers. Some suggest we can achieve herd immunity by letting the virus spread through the population and get back to normal more quickly. Is that valid?
Thank you. So the term herd immunity refers to when a large portion of a community becomes immune to an infection. And then the fewer people that have the infection, the fewer people that there are to pass it on. So as a result, the whole community becomes protected, not just those who are immune. There are some major problems with relying on community infection to create herd immunity to the virus that causes COVID-19. We think having the infection makes one immune, but that hasn't been totally proven yet. But even if the COVID-19 virus creates long-lasting immunity, a large number of people would have to become infected to reach the threshold for herd immunity. And if that many people become ill with COVID-19 at once, the healthcare system would quickly become overwhelmed. And this amount of infection would also lead to serious complications and a large number of preventable deaths.
Thank you, Dr. Helmers. Another question for you, Pam. Why should healthy people be concerned? It seems only the elderly or those with underlying health conditions will get very ill and require hospitalization for COVID-19.
So we know that people of all ages can contract COVID-19. We've seen that. We've heard of that. You may be all familiar with someone who has contracted COVID-19. However, the risk of developing dangerous symptoms from COVID-19 is really increased in people who are older or in people of any age who have other serious health problems, such as heart or lung conditions, weakened immune systems, severe obesity, or diabetes. Many times health conditions completely out of control that you just are more highly impacted by COVID. People from all age groups are being hospitalized with COVID-19. We have seen every decade of age hospitalized. The average age of COVID-19 individuals who are hospitalized at Mayo Clinic Health System fluctuates day to day. I will tell you, probably 2 to 3 weeks ago, the age range or age average was much lower. I'd say in the mid-50s. However, over the last week or so, the last couple weeks, that average age has gone up significantly so that it's closer to the high 60s and 70s of those that are hospitalized. However, we have seen very severely ill individuals in their 20s, 30s, 40s, all ages across the spectrum.
Thank you. Thank you very much. And thanks to Pam and Jason and Dr. Helmers. I know we're starting to near the end of our time together, and I wonder if you have any closing comments you'd like to share with our guests.
Thank you, everyone, for your support and for your questions. We are all so fortunate to provide care here in Western Wisconsin. We know each of you is feeling the pressure too. We're all in this together. We are grateful to all of you for doing your part. And each day that passes brings us one day closer to the end of this. Thank you again for helping to lead by example in the community and encourage everyone in your network to do the same.
And I agree. Thank you to all of you for your participation and support. Our nurses and staff on the front lines are dedicated and working so hard, and they need your help and empathy. Please lead by example in the community and encourage those in your families, workplaces, and social circles to do the same. Please be vigilant with wearing your mask, avoiding medium and large gatherings, washing your hands, and keeping space between you and others. We know that works. Help us so that we can have our full capacity to help you.
So I also want to extend my thanks to all of you for joining us here today. Again, it's humbling to have so many interested in what's going on and so many supporters of what it is that we do every day. In past comments, I referenced the compassion and the care of this community, and we could not be prouder to be a part of this community and could not be prouder to serve this community. We referenced that back in the spring, so many of you and your businesses were so generous to us, providing our staff with meals, putting together civic groups to create masks, and supporting us in so many different ways. What we need now more than ever from this community is the support for our staff and our patients by following those public health guidelines that Pam just referenced. We need your help in a different way, but in just as meaningful a way. And again, we could not be prouder of this community, and we can't thank all of you enough for your time, for your willingness to help and your willingness to influence others.
Thank you to our leadership team and to all of you again for joining us today. We truly appreciate your interest, your partnership, and all of your efforts in helping slow the spread of COVID-19 in our community. So thank you all. Be well and stay safe.